We appreciate you taking the time to speak with us.
Of course.
Are you ready to answer a few questions?
Sure.
Okay, let's start with your name
My name is Megan.
and what you do here at Benefis.
I am a vascular access specialist.
And tell us why you chose to pursue nursing in the first place.
So the reason I chose to pursue nursing in the first place, I was actually a journalism major in college. Ended up having my mom diagnosed with cancer the day before my 19th birthday. So ended up moving home to help take care of her here in Great Falls. Continued the rest of my general education here and was really inspired by the nurses that worked with her, and I decided to become a CNA on the oncology unit and apply to nursing school and have loved it ever since.
And what led you to the vascular access team specifically?
So specializing in oncology, we deal with a lot of central lines, particularly portacaths and PICC lines. That was my primary specialty originally, was oncology, and then I moved into vascular access while still continuing to work as an oncology nurse. And the more involved I became with that, I started teaching some of the portacath classes and started becoming pretty close with the PICC nurses and talking to them about what they do. And it was really cool to learn about all of the skills and the in-depth education that you can get about vascular access and vascular nursing and procedural nursing.
So tell me what the vascular access team is able to do for our patients.
So the vascular access team plays a lot of roles in the hospital. First thing that we do is we are PICC nurses first. So that's what most people know us as, is the PICC nurse. We place peripherally inserted central catheters, which are a special type of IV that goes to the vein just above the heart. These are utilized specifically for our heavy-hitting medications, like our long-term IV antibiotics, chemotherapies, TPN, and things like that. Those are the types of medications that can really rip up your peripheral veins. The way I like to describe it to my patients is you've got your grocery bag veins and you've got your hefty bag. Your grocery bag veins, if you are carrying a lot of heavy cans, you're going to rip right through them eventually. Whereas if we're using that hefty bag, it's less likely to cause damage, it's much more convenient for the patient, and it's much safer overall. So our primary role is placing those catheters. Part of that role is we go through an extensive evaluation of a patient's chart. We work really closely with the multidisciplinary team, particularly with infection prevention and infectious disease, to make sure that a patient is appropriate for placement of these lines. We actually do a lot with monitoring for central line bloodstream infection. So we do a lot of the physical rounding on patients to ensure that patients aren't showing any signs of CLABSI and are at reduced risk of CLABSI. We also will provide help on the floors for just regular IV access. So we'll get a lot of phone calls. When you have a patient that's a difficult stick, we really want to be able to protect our patients from harm overall. And the more often we're poking patients, the more potential we have for harm. So the nurses know to utilize us as a resource when they run into those really difficult veins.
And what's your favorite part about working on your team?
I would say the favorite part about working on our team, for one, our team is wonderful. We are really good about encouraging each other to really expand our knowledge and expand our overall specialty. So over this past year, we actually became the first vascular access team at Benefis for quite some time to be fully nationally certified as vascular access specialists. So we are all board certified. We're extensively trained in vascular anatomy, in ultrasound guidance and evaluation of vessels. We really encourage each other as a team to excel as much as possible and make sure that we are providing as much knowledge and skill for best patient care.
What would you like other Benefis employees and, our patients and community to know about your team and what you do?
I would say what I would really like for other Benefis employees to know is that we do more than just place IVs. We're more than just an IV team. We're more than just placing PICC lines. We never mean to be picky about who we're placing lines on, but we are going to take the time to research our patients before we go poking them. We want to make sure that we have the right devices. We want to make sure that we are truly doing the best possible thing for our patient. When it comes to the community, we'd like for them to know that we are here. You're allowed to ask for us. We will always do our PICC lines first, but we're available to help with IVs if necessary. And we're just another part of that team that tries to help as much as possible.
And what's your favorite part about working at Benefis?
I would say my favorite part about working at Benefis is the number of opportunities that I've had throughout my entire career. It's really helped me to gain experience as a nurse, and it's really helped me to expand all of my skill set and knowledge. So,
Well, we really appreciate you taking the time to speak with us.
yeah, thank you.